Hi, hello, welcome to my YouTube channel, All Nicing MCQ. First question is total hip arthroplasty means. Options are option A, fuse the joint, option B, replace the hip joint, option C, fixation of femur with rod, option D, remove the cartilage tissue. So the answer is option B, replace the hip joint. Next question is branch traction is indicated in. Options are option A, fracture of femur, option B, fracture of humerus, option C, spinal fractures, option D, fractures of radius. So the answer is option A, fractures of femur. Next question is winds of deformity is seen in which of the following disease condition? Options are option A, rickets, option B, scurvy, option C, ankylosing spondylitis, option D, achondroplasia. So the answer is option A, rickets. Fourth diseases. Options are option A, TB meningitis, option B, TB spine, option C, TB bone, option D, TB lung. So the answer is option B, TB spine. Most common cause of upper GI bleeding is. Options are option A, gastric ulcer, option B, esophageal varices, option C, gastritis, option D, carcinoma stomach. So the answer is option A, gastric ulcer. Pain in the McBurney's points is a characteristic feature of. Options are option A, cholelithiasis, option B, appendicitis, option C, urolithiasis, option D, nephrolithiasis. So the answer is option B, appendicitis. Murphy's sign is seen in which of the following disease condition? Options are option A, liver abscess, option B, splenomegaly, option C, peritonitis, option D, acute cholecystitis. So the answer is option D, acute cholecystitis. The presence of Kaiser-Felixter ring is seen in. Options are option A, curvatures, option B, Lowe syndrome, option C, Wilson's disease, option D, cirrhosis. So the answer is option C, Wilson disease. The normalization of capillary permeability after burn injury will take up to. Options are option A, 1 to 2 weeks, option B, 2 to 3 weeks, option C, 7 days, option D, 14 days. So the answer is option B, 2 to 3 weeks. The cartilage that completely encircles the larynx with the narrow part anteriorly and the broad part posteriorly is called. Options are option A, thyroid cartilage, option B, cricoid cartilage, option C, arytenoid cartilage, option D, epiglottis. So the answer is option A, cricoid cartilage. Which among the following activity helps in the production of surfactant? Option A, taking deep breaths. Option B, coughing exercises. Option C, sternus exercises. Option D, ROM exercises, range of motion exercises. So the answer is option A, taking deep breaths. Trachea start at the level of, options are option A, fourth cervical vertebra, option B, fifth cervical vertebra, option C, sixth cervical vertebra, option D, seventh cervical vertebra. So the answer is option C, sixth cervical vertebra. When caring for a client after cardiac catheterization, which nursing action is most important? Options are option A, administer oxygen, option B, provide rest, option C, checks the ECG every 5 to 15 minutes, option D, check a pulse distal to the insertion site. So the answer is option D, check a pulse distal to the insertion site. Which among the following parameters suggests that pericardiocentesis was effective? Options are option A, increased JVP, option B, increase in pulse paradoxical, option C, increased blood pressure, option D, muffled heart sounds. So the answer is option C, increased blood pressure. Immediate treatment of choice for ventricular fibrillation. Options are option A, administer adrenaline 0.1 mg per kg. Option B, defibrillate with 360 joules. Option C, cardioversion. Option D, administer antiarrhythmic drugs. So the answer is option B, defibrillate with 360 joules. A patient with pernicious anemia is receiving vitamin B12 injection. The client asks to the nurse, how long I will receive the therapy? The best nursing response is, options are option A, till blood level of vitamin B12 became normal. Option B, till your hemoglobin level improves. Option C, lifelong. Option D, for 1 month. So the answer is option C, lifelong. Hemophilia is associated with, options are option A, S chromosome, option B, Y chromosome, option C, chromosome 11, option D, chromosome 21. So the answer is option A, X chromosome. In DVT clients, pain can be managed by, options are elastic stocking, leg elevation, range of motion exercises, hot application. So the answer is option B, leg elevation. Which of the following vaccine is contraindicated during pregnancy? Options are option A, MMR, option B, hepatitis B, option C, DPT, option D, DT. So the answer is option A, MMR. Identity versus role confusion is a task of which stage of development according to Erickson? Option A, toddler, option B, preschool, option C, adolescent, option D, adult. So the answer is option C, adolescent. Techniques of psychoanalysis include the following except option A, exploration, option B, free association, option C, clay association, option D, transference. So the answer is option C, clay association. In which defense mechanism anxiety is expressed through physical symptoms? Option A, projection. Option B, regression. Option C, conversion. Option D, hypochondriasis. So the answer is option C, conversion. Compared to the use of vacuum extractor, forceps delivery associated with increased risk of. Options are option A, minor facial injuries. Option B, cephalohematoma. Option C, retinal hemorrhage. Option D, intracranial hemorrhage. So the answer is option C, cephalohematoma. The recording of conversation between the nurse and the patient in a psychiatrist setup is termed as option A, therapeutic communication. Option B, interview technique. Option C, process recording. Option D, case study. So the answer is option C, process recording. A defense mechanism that allows to convert our unacceptable behavior into acceptable form is. Options are option A, introjection. Option B, sublimation. Option C, projection. Option D, displacement. So the answer is option B, sublimation. Thanks for watching. Please subscribe and like our channel. Thank you.